Hi, Dr. Centeno, and let's get into sterility and the PICL procedure. Now, we've seen the rise of fake and bake PICL procedures in Europe by providers claiming to do the PICL procedure. In my opinion, they're not offering anything close to the PICL procedure. But one of the big differences there is sterility. One of my concerns for a long time has been if you're using PRP taken from someone's arm, it's not going to be hyper sterile, right? Hopefully, in most instances, it's sterile enough. But the only way you can get a hyper sterile platelet product is through a bone marrow aspirate, which is done under a surgical prep. Now, a surgical prep is much more sterile than drawing blood from an arm. And if that's your input, and you then it goes right from the sterile operating field into a cGMP-class clean room, you've now got a hyper-sterile process. That doesn't happen with little bedside centrifuge kit. There's just no way to do it. Always going to have that be a less sterile process than the one I'm describing here, a bone marrow aspirate taken under a surgical prep and then moved into a clean room for processing and then back to a surgical field. So that's one of the reasons why we don't do PRP taken from the arm and put into a little bedside kit for the PICL. There's just too much at stake for the sterility of that process. Thanks so much for watching. Have a great day.
Hey, get this out to more patients by like, comment, share, subscribe. Thanks so much.